The heart is a dense muscular organ which circulates oxygenated blood around our bodies with the assistance of the cardiovascular system, which is composed of blood vessels, arteries, veins, and capillaries. However, like any organ in the human body, it is susceptible to disease and failure. How can we diagnose diseases and prevent diseases of the heart if we can't look inside of it? My name is Nikhil Singh, together with Tatsuki Kirkland and Marcel Wirjana. In this video, we aim to show you 6 different types of cardiac imaging modalities and work out which imaging modality is best suited to provide medical images of the heart for diagnostic purposes. The first one is cardiac catheterization. It makes use of a catheter, which is a long, thin, flexible tube which is usually inserted in the radial artery near the wrist or the femoral artery near the groin. Dye is injected into the catheter and will flow through your bloodstream to the heart. The dye will then illuminate the coronary artery and other major areas of the heart. Doctors may refer you for a cardiac catheterization for a number of reasons. The main reason would be to see how your heart valves are functioning. The valves in your heart control the blood flow to your arteries and to different parts of the body. A major advantage is that help doctors diagnose and detect heart problems before they become critical, such as heart attacks or strokes. A catheterization is classified as a minimally invasive procedure. A small incision is made and most of the time the patient is under anesthetic, so they can't feel any pain and the risk of complications are low. There are also a number of risks associated with the procedure. These include bruises may develop where the catheter has been injected, the dye used to highlight arteries may be ingested, causing some patients to feel sick and throw up, and other complications include damage to the walls of arteries and blood vessels where the catheter has been placed along. Moving on to cardiac CT scan, which is a computer tomography scan of the heart. A CT scan is a medical imaging procedure that uses X-rays together with computer technology to create 2D and 3D images. Since the heart is a very dense muscular organ, dye is used to create a detailed picture of the heart and its blood vessels. The advantages are that it's relatively non-invasive, it's a relatively quick procedure which only lasts around 10 to 15 minutes, and allows doctors to see a 3D representation of the structure of your heart without making any incisions like you would with a catheter. CT scans also detect and illustrate calcium buildup and blockages in the coronary artery due to its fast multi-detector scanner. A heart CT scan carries with it very little risk. However, patients can have allergic reactions to the iron-based dye, which has a metallic-like flavor. If allergic to iodine, patients can develop itching, skin rash, hives, and in some cases, cardiac arrest.
Now we have myocardial perfusion imaging. It's an imaging that compares the heart at rest and the heart at stress. Myocardial perfusion imaging uses heavy element radioisotopes to mark areas of the myocardial perfusion. Perfusion is the ability to deliver blood to capillaries. So when the blood is perfused with radioisotopes, we then want the heart to be at stress so that blood can be delivered. We then capture the stressed heart muscle and compare it with the heart muscle at rest. In this image below, the top row shows the muscle under stress and the bottom at rest. When we see a big difference between these two images, that means there is part of the heart where it is not getting enough blood, and that could be a risk to a heart attack, or it could be a sign of insomnia. The advantages of myocardial perfusion imaging is that it can help diagnose heart condition by giving information such as the size of the heart, how well the heart pumps up blood, and the effectiveness of current treatment. The disadvantages include the risk of the radiation, and some people have allergic reaction to the heavy element. Here we have cardiovascular MRI. It applies the same principle as magnetic resonance imaging, which uses magnetic fields and radio waves to form images of the body. It can be used to produce moving and still images, such as in the figure below. The advantages of using MRI is that we can use it to assess cardiac structure and function. MRI shows clear contrast between tissues, which you can't get from using CT or X-rays. The disadvantages of using MRI is that they are expensive to use.
Echocardiogram is a test utilizing ultrasound to create images of the heart. The images are produced by a transducer emitting high-frequency sound waves directed towards the heart, and the time taken for them to echo back is recorded and analyzed to create an image. Echocardiogram can create images of specific parts of the heart, including the chambers, valves, and the blood vessels. Echo tests are useful for determining the shape and size of a patient's heart, as well as how it functions. The heart's pumping strength, valve movement, and thickness of the heart's walls are some of the functions that can be examined with echo tests. This can help identify anything that may be of concern, including problems with the aorta and blood clotting in the heart's chambers. Echo tests are used when a patient has clinical or radiographic signs of heart failure, hypertension, suspected or known heart diseases, and strokes. The most common type of echo testing is transthoracic, where the transducer is passed over the chest. This technique is non-invasive and harmless. However, if the results are not clear enough, a transesophageal echo technique may be used. This technique involves the transducer to be passed through the esophagus to capture a clearer image of the heart. Other techniques include stress echo, where the patient is examined after exercising, and fetal echo, where during pregnancy the baby's heart is examined from a transducer above the belly of the mother. As echocardiograms use ultrasound, there is no radiation that can affect the body, as only sound waves are being used. It is a very safe technique that is quick and effective at producing images of the heart. Standard echo tests will cost from $1,000 to $2,000, and even more for complex procedures. Another disadvantage is on very rare cases, the transesophageal echo test can irritate the sides of the esophagus, leading to a sore throat. A chest X-ray is a test that produces images of the internal body parts via the passing of X-rays through the chest. Images produced from chest X-rays help doctors inspect the heart and identify any problems that are apparent. Problems such as a thicker or larger sized heart can lead to heart failure due to the incapability of pumping enough blood throughout the body. Larger hearts can be determined with a ratio of cardiac width to thoracic width. This is known as the CTR. If the CTR is larger than 50%, it is considered abnormal. X-ray imaging procedures are non-invasive and are very painless. X-rays are fairly inexpensive, costing roughly $200 to $400. In this procedure, X-rays are used, which in high doses can harm the human body. The amount of radiation used must be as low as reasonably achievable. X-ray images have a turnaround time of around a week, so if immediate inspection of the heart is necessary, other cardiac imaging techniques may be required. There is a wide selection of cardiac imaging techniques available, both invasive and non-invasive, where each one serves its own purpose. That being said, in many situations concerning the heart, being able to quickly produce clear images is very important for detection of abnormalities. It is important to remember that these tests are often done in conjunction with one another. A health professional may refer you to undertake a chest X-ray followed by an ECG. Hopefully now you have an understanding of the various cardiac imaging techniques and their uses with the pros and cons. Thank you very much for listening.